So far, the biggest news story of 2010 is the National Health Plan. All right, I've had computer disasters. I know what it feels like to lose all those important files, and I'll tell you something, I never, ever want to go through that again. That's why I use Carbonite Online Backup. Now, while your computer is connected to the internet, Carbonite could be backing up all of your important family photos and personal and work files. And it does all this for just $55 a year. Carbonite backs up all of your files and then helps you get them back when you have that computer disaster, that accident, whatever you want to call it. Now, as a Kim TV viewer, you get a free 15-day trial, plus 2 free months if you decide to buy. Now, don't wait until it's too late. Just hit pause and then click on the Carbonite ad right over there. And then take a few minutes to sign up for your free trial. And when you're finished, come on back, because I'll be right here waiting for you. Carbonite.com. Back it up and then get it back. Nothing in recent memory has been so polarizing. No one here is on the fence. Now we move on to step 2, making this plan work. A key part will be President Obama's ambitious goal of digitizing all the medical records of every American. These records currently exist in paper files and all kinds of different data storage formats in doctors' offices and hospitals across the country. I say that the goal is ambitious because the president wants to get this done by 2014. That's 4 short years. I'm talking about the files that were made from every doctor visit, every emergency room treatment, hospital stay, all your prescriptions, all your x-rays, and all the other tests of every single American. Now, that's quite a bit of files. On the surface, this sounds like a terrific idea, and there's no question that patients can benefit if a doctor has access to a patient's full medical record. Unfortunately, this isn't the only consideration. Right now, scattered as they are, our private medical records are in the hands of private organizations. But we're talking about a government-administered universal health plan. The key word here is government. And now we can see some troubling questions ahead. The first is obvious. What will the government do with all of your medical records? Exactly who will have access? And exactly how many different kinds of government agencies and bureaucrats will be able to access this massive database? Over the past 5 years, there have been over 260 million documented data breaches in the United States alone. And what about errors? Hundreds of millions of records will produce millions of errors, some small, some very serious. And with all of our medical data collected and stored in one place, all of us will be just one data breach, just one lab test, just one prescription away from years of possible discrimination in jobs, future advanced medical care, you name it. I'm not saying that this can't or shouldn't be done. What we're talking about is tracking down and locating, collecting, translating, digitizing, and storing the files of hundreds of millions of us, private and very sensitive data. My data. And this is one area where we need to move slowly. We need to answer questions, put in safeguards, and pass laws to make sure that our privacy and our rights are fully protected.